Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging. We want to help you be more successful. And our guest today is Tom Gillette. He's CIO at Mount Sinai Medical Center. Welcome, Tom.
Hey, John, thank you. Thanks for having me.
Yeah, I appreciate you coming on. You're doing some exciting work and multilingual work, which I love as well. But before we get to that, tell us a little bit about yourself in Mount Sinai Medical Center.
Yeah, so again, my name's Tom Gillette. I'm the Chief Information Officer at Mount Sinai Medical Center. I've been in that role for over 20 years, so
Wow.
I feel
That's
like it's
unheard of with CIOs. That's amazing.
unheard of. Yeah, I think I have the longevity record here in South Florida.
That's
Um,
awesome.
and I
Congrats to you.
started at a time when our organization was very paper-based, and we've
Mm,
gone through a very exciting digital journey over the last 20 years, culminating now in some of the AI initiatives that we're working on. So, as a CIO, I think it's the most exciting time of my career right now. So it's been great. You know, Sinai is a wonderful place. We have a flagship hospital on Miami Beach. We have multiple freestanding emergency departments in Dade County. We have 15 satellite locations with physician offices and other services from Monroe County all the way down in the Keys, all the way up north into Aventura and out west to Hialeah. It's a growing enterprise. It's $1 billion organization,
wow.
and we have plans over the next few years to open up a new cancer center in 2026 and other facilities beyond that. So the technology work that I do is very impactful in terms of setting ourselves up on platforms that can help us scale and achieve the vision that we have.
Well, now I understand why you wanted to stay there because you live in the most beautiful area. So I get why you wanted to be there 20 years. That's
It's
awesome.
not terrible, I'll give you that.
There's a lot of good things in those areas. So that's great. Well, I learned that you've been doing a bunch of work with Epic's Art for InBasket, which is their AI solution. What's been your experience, using art for InBasket messages in Epic?
Yeah, art's been a really valuable tool for us. We started using art, which is the automated response technology, in 2023. So we've been a long
Wow,
time
early user.
user of that. Yeah, we were one of the early adopters of the technology. We've been somewhat aggressive in adopting AI overall, and Epic as a flagship partner, we really wanted to take advantage of the tools they offered. So we did start using art in 2023, back when it was called generated draft response, and it was really timely because this was right, you remember in COVID, when a lot of facilities had limited physical access, we saw that our patients were reaching out to us digitally. And we had an explosion of inbound digital messages from patients to our providers, almost a 400% increase from before COVID to today. And that's good and bad. So I think that the good news is that we see our patients reaching out to us through that channel. The downside is managing the response to those inquiries, making sure they're timely, they're medically appropriate. We're getting messages in lots of different languages, which I know we're going to talk about here today. So having some technology to help with that has been great. You know, it's been a win-win uh, opportunity for both our patients and our providers to manage those messages.
Talk to me more about that growth of digital messaging. I mean, everyone saw it, right? I mean, this is a theme we've seen
Yeah.
across so many health systems, healthcare organizations. Do you expect that trend to continue upward? And where are you headed with all that messaging? Do we want to encourage it more? Do we want to move it to other, avenues? Or how are you approaching kind of that
Yeah, we want to encourage
explosion
it.
of
We
messaging?
want to provide, an omni-channel, multi-channel experience for our patients. So, they certainly have the My Chart portal to interact with and get information. We have a very large call center experience for patients to interact with humans. We are turning on things like e-visits, which we can talk about, which is an asynchronous opportunity to have a visit with your provider. We are encouraging more messages and using this channel. Access is really our main goal. So any way that patients can access healthcare and our providers, we're trying to push all of those channels equally. So we do expect this to increase. And again, using tools like AI will help us respond to that.
Yeah, that's awesome. You're doing e-visits. It's amazing how much can be done. For all of us that know a lot of doctors, we do that anyways ourselves, right? Because they're our friends and they'll do it for us, but they are not HIPAA compliant. But like they're
Right.
friends, so it's a different visit, right? But
I'll tell you, John, we see, some of these messages, and e-visits is a good comment to make. A lot of these medical advice questions that are coming in are e-visit appropriate.
mm,
So we can direct patients to use e-visits. We can respond to the patient messages. The e-visits have a faster guaranteed turnaround time. So again, encouraging patients to use the right channels that fits their need is something we're really pushing for.
yeah, that's cool. Well, tell me more about how art's helping to reply to those messages. And you're the first adopter to use art for messages in Spanish, which you kind of alluded to. Tell us about how that works and some of the nuances of using art for messaging in Spanish.
Yeah, again, so we've been using art for a long time. One thing that we've done in general is we've been very specific in our prompt engineering behind the scenes. So while you start with Epic with a basic infrastructure, we work very closely with Epic, our um, physician services and administration group, our IT team, obviously, to tune the prompts for each specialty, for each scenario that's being presented. We're not only providing drafts to responses from a wording perspective, we're reaching into the chart to pull relevant information about that patient, what medications they might be on, what upcoming visits they may have, what recent lab results are in their chart, and using all of that in context to generate a draft response. That's been very helpful because from the provider side, they would have to do that anyway. They'd have to sift through the chart, look up that information, remind themselves of what's going on with this patient, and write a response from scratch. We're really giving providers now a huge head start with
Wow.
that draft that incorporates relevant information from the chart and that lets them reply with less time, less, their own time putting into the message, a faster response time to the patient. Patients are getting responses about a half a day sooner than they were otherwise.
Wow.
And we're seeing less time providers are spending after hours responding to messages. I think the key thing is that these are just drafts, so where nothing is being replaced from the provider's discretion. This is not automating responses directly to the patient. It really just augments, what the provider is doing, and
That's
doesn't
awesome. And I
doesn't
actually
relieve
love
any of
it.
the decision making, right, from
Sure.
the
Yeah,
provider's
absolutely.
judgments.
I love the idea that it's digging in the chart because you can see this value-based care future world where you're like, oh, you need to know that, hey, they have a wellness visit or they have a follow-up that they missed. Like it gives you that opportunity to kind of leverage that from a value-based care perspective as well. Yeah, that's interesting.
100%. 100%. And on the Spanish side, I'll say that um, we're very proud to be the first healthcare organization to implement the Spanish language version of this. We have a huge population that speaks Spanish in South Florida. As I
Yep.
think many people know, I think over 60% of people in Dade County speak Spanish. 30% of our patients have indicated that Spanish is their preferred language in our EPIC system. So being able to communicate with those patients again in the channel that they want, in the language that they want, has been huge for us. So until the Spanish language version of art came along, patients would communicate with us through that channel, either, in English, which wasn't their preferred language, or they'd send us a Spanish message and we'd have to manually translate that or just call them back. We couldn't take advantage of the AI tools there. Now we've seen by implementing Art Spanish, which we did in December of 2024, we've seen a huge spike in the ability of our providers to use the drafts and respond to patients in the language that they want. So that's been a game changer for us in that regard. I'm looking forward to other languages and working with Epic on that too.
Yeah, I mean, it's amazing to think about, right? Like, what a patient disconnect. If the patient sends you a message in Spanish, maybe because that's all the only way they could send you a message, and you reply in English, or like you said, you have to call, which is the misery and death of every provider if you have to do that, right? That's not good.
Yeah, and it lets us again be more responsive, and it's not just a technology um, achievement here. This is really getting more patients into, feeling comfortable with the Mount Sinai ecosystem.
Mm.
It's an inclusive experience. We're much more responsive. They find us much more accessible. That creates stickiness for us. That's really invaluable. So I think, again, the dividends that this technology is paying may seem, like a small success from a sort of technology win and all of that. And it's more than just a cool thing to do. It's really responding to patients in the language that they speak and getting right to them more quickly.
Yeah, and I've seen studies where, using the language that's their native language actually improves care as well because it's communicated properly and some of the things that you've mentioned. So, it's again, that goes back to the value-based care again, and improving the quality that they receive. That's awesome. Are there some other technology challenges you face having such a large Hispanic and, I mean, multilingual, not just Spanish patient population?
Yeah, I mean, I think the answer is yes. I would say that we think we do a good job with bridging that language barrier, so to speak. We obviously living in this community, our employees, from this community. We have a lot of Spanish speaking employees, multi-language speaking employees. So I think from that perspective, there's not an issue there. But from a technology perspective, I think there's a couple of things we've seen. Certainly the MyChart portal, while it's available in Spanish, which is great. Sometimes the medical terms or clinical terminology doesn't translate fully. When you're reading your provider notes, for example, or you're referring to patient education that may have been given to you, while those can be translated one for one from English to Spanish, again, sometimes the clinical context doesn't resonate as well. Um, so I think that's a barrier, and I think that's another opportunity, frankly, for technology to solve, specifically with AI, to not only perform a language translation, but putting content in a reading level and a reading context that's appropriate for that patient, in addition to language. That's something that AI can really help us with.
Yeah, that's not even a language issue. I mean, I see medical terms and don't understand them. I need them dumbed down for me too, right? Like that's a common problem across languages. So yeah, it's definitely an opportunity for AI to help us as well. That's awesome.
100%. 100%.
Moving beyond kind of the in-basket and messaging and the translation stuff, what other health IT or AI projects are you working on that, have you excited?
Yeah, I think we're doing a lot. In addition to being an early adopter with the art technology from Epic, we were also an early adopter with ambient listening. I think a lot of people are are doing ambient listening where we've been using that for over a year now with our providers. And that's another one that's been a real game changer for us. Our providers find that um, to be incredibly helpful with generating, again, draft notes. Again, nothing is completely automated. They get a draft, they can edit that, they save that to the Epic record. We see much faster turnaround time. We see much more comprehensive notes being written with ambient listening. So that's something we're rolling out to more and more physicians. We're talking about rolling that out in an inpatient setting for nurses to use. We're talking about using that in our emergency department for our ED providers to generate draft notes. So I think ambient listening is a technology that's really going to take off, something we've been doing. I think another one is virtual nursing.
Okay.
So we're in the process of installing uh, speakers, microphones, cameras, TVs in all of our inpatient rooms using the Artisight platform. And that will help us in a number of ways from fall prevention, uh, telesitting technologies, virtual nursing, admission discharge workflows. We're looking at a lot of that. So I think that computer vision technology is something that's going to be big for us. We're going to go live with our first installment of that in September.
Wow.
So we could come back and do another session on that. I think that's very exciting. I think
Yeah.
the other thing is we're seeing a ton of technologies in the radiology and cardiology space that are AI related. We've been using a number of those specifically in radiology to add algorithms to the radiologist toolbox to help them identify things in images, write reports better, faster. Um, we are doing something in cardiology now to help with plaque analysis and other things on CT scans. So just incredibly helpful. I can tell you that there's one story that I'll tell you about.
Yeah, I'd
We
love
had a
that.
patient come into our emergency department and was, I won't go through all the details, but was in for one issue. We did a number of diagnostic images on the patient, and the AI flagged something that was really critical for that patient, and immediately got that patient the care they needed. And I won't be dramatic, but it could have saved their life.
Yeah.
At least our radiology team will say that it was a life-saving intervention based
Yeah.
on the AI being able to read something and diagnose it that quickly.
That's
So
amazing.
a lot going on with AI here at Mount Sinai.
I mean, you bring up an interesting question that I think every CIO is kind of battling with. I'd love to hear where you're at on it and how you're approaching, because the EHR vendor, in your case, Epic, is providing a lot of AI solutions. You're implementing some radiology solutions. You're implementing some AI with virtual nursing and nurse sitting and things like that. How do you approach it from kind of a best of breed versus, hey, I want one platform or I want one from my existing providers? And, I don't think there will be one AI platform for every single thing you need, radiology, RCM, clinical, et
Great
cetera. So
question.
how do you balance that, and
Yeah,
how do you see it kind of playing out? Are you cool to implement best of breed because you need to, or, how do you
that's a
balance
great
that?
question. I mean, we almost need another podcast for that, but I'll
Let's
tell
do
you, yeah, we should do that. I think that it's a great question, and our goal is to leverage as much of the Epic, on the Epic side, we certainly want to leverage what Epic provides. I think that's a no-brainer. As far as the radiology and cardiology space, there are a lot of best of breed solutions out there that do one thing. There's a lot of that do one thing great. There's a number of solutions that are more platform oriented that do many things. I think you're right. Finding the balance between that's a challenge. We lean more towards the platform-based AI solutions. And once we use a solution like that, there may be something that's better or best of breed, but we always challenge ourselves, you know, we already own a platform. Why can't we just use that? It may not be as good, but if it's pretty close, we prefer to stick with that platform. So I'll tell you that we are a big user of AI Doc as an example,
Mhm.
and they have many algorithms related to radiology use cases. There's a number of specialty products that overlap with that. Our preference is to stick with AI Doc as much as we can, just as an example.
Yeah.
Um, I'll tell you that the bigger picture is we have an AI governance committee that we started this year, and that's a group of people that well, we have physicians, we have nursing, we have compliance, risk, legal, IT, etc. And that group will review every AI solution that comes into our onto our system. We have three goals with that committee. One is to make sure we evaluate everything properly, and there's an entire process around that that's AI specific. We have a process where we want to validate solutions after they're implemented to make sure that the promises that the vendor made around the accuracy of different models and so forth, we're seeing that in our own environment. And the third charter of this committee is to measure the impact that AI
Wow.
solutions are having from a financial ROI, clinical ROI, operational ROI. So we're trying to be very mindful of adopting AI solutions in a methodical way, in an appropriate way, and then revisiting, what impact they're making.
And I think that's interesting. I've heard CIOs on this podcast talk about, well, we already have an existing governance committee, or we create a separate AI governance committee. What went into your decision? I'm sure you have another governance committee as well. Why did you decide to do an AI specific one? Is it just because there's so many things, or yeah, I'd love to hear that decision.
Yeah, I think we certainly have an IT steering committee in general that, we've had forever that, reviews the IT strategic plan and our budgets and our spend timelines, key projects, etc. The AI, it just so new. It just so
Mhm.
new. Everybody's interested in it. Everybody wants to, shape, how we're adopting these tools. So again, the multidisciplinary group that I mentioned, all those people want to learn, understand how this impacts us, the decisions we're making. So I think for that perspective, we wanted to make sure that we're educating everybody as we go through this journey. We certainly feel like we're in the early innings of this process. So we think getting more people in that specific boat has been helpful. That governance committee not only does the three things I mentioned, but we talk about AI in general, AI in the news, specifically in healthcare, what's going on. We talk about prompt tips of the day, right? Because
Oh,
people are very
interesting.
interested in how do I use this, within or outside of work. So it's a very interesting meeting. I'll tell you, it's the most well-attended meeting that I've had in 20 years, being
That
at
might
Mount
be a good
Sinai.
enough reason in itself to have its own meeting, because they want to be part of the sexy meeting, not
They
the
want to be part of it. But yeah, just everything's so new and people want to be a part of it. And we wanted to dedicate, a specific time to it. We have an
Awesome.
AI placemat that we track, which has
Okay.
about 40 different AI solutions on it that are either implemented or under evaluation.
Wow.
So it does require almost its own committee to manage and monitor that.
It's moving so quickly. That's awesome. Well, Tom, we always like to end these episodes with a little bit of career discussion, career advice. What would you say is maybe the best piece of advice that you've been given in your career?
So I've been given a lot of advice over the years. I
Best
think
is
it's
always
hard
a
to,
hard part.
I know it's hard to pick just
It's
one.
good. A good piece of advice. It's good.
It's hard to pick just one. I think specifically in healthcare, one piece of advice I've been given is to always present solutions backed by data.
Mm.
So, it's one thing to sort of talk about, and this is timely with AI, it's one thing to talk about technology, sometimes for technology's sake. But I think the advice was talk about the impact that it has on operations. Talk about how, when you're talking to clinicians, support any solutions that are being proposed or evaluated with real life data, how it impacts them, how it impacts the patients that they're seeing. If there's evidence, physicians in particular are tremendously smart people. They like data. They're moved by information and specificity. So I think, again, the advice I was given is, when you're presenting and talking about IT solutions, it's not a techie conversation. It's about the impact that these solutions can make in our environment for providers, patients, the hospital system, etc. So I think when I've done that, I've always been more successful at making my point and getting buy-in on solutions and moving forward. And when it comes to AI, it's even more important because it is so new and there's a lot of unknown. And we seem to be sometimes just jumping into the deep end to try things. And that's okay, but coming back after some period of time and saying, this has been the impact, this is what we saw, here are the analytics, it always seems to resonate better when it's more fact-based and evidence-based than word of mouth or conjecture. So I think, especially in healthcare, I've found that to be true.
Yeah. I mean, I think CIO could almost be described as chief salesperson officer for IT. And the best way to sell something is to actually talk about the impact. And if you can't describe the impact, well, maybe we shouldn't do it, right? Like there's a bigger
Yeah, I
issue
think, yeah.
there.
Yeah, the CIO stands for Chief Inspiration Officer.
Oh, I like
Yeah,
that.
you
Very
really got to
good.
inspire people
Yeah,
to the
understand how it
promised
could
land.
impact them. I love that.
Yeah.
Tom, this was really insightful. I appreciate you taking time to sit down with us to share your experiences and congrats to all the work you're doing with your team there at Sinai. I appreciate it. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting applications. Thanks, Tom.
Thank you, John.